Okay, so we are back again. We are talking about administering a nebulizer to a patient who is wearing oxygen. All right, so now we are going to give a nebulizer to Ashley with a mask. All right, and so sometimes if the patient cannot hold the mouthpiece, if they can't keep a seal around the mouthpiece, a mask is appropriate. If their level of consciousness is not well enough to be aware of what they're doing or follow directions, a mask is also something that we can do. So with the mask, everything is pretty much the same. We're going to keep the oxygen on. We are not going to remove the oxygen. She's on 2 liters of oxygen. We are going to connect our O2 tubing to the cup, and so sometimes the cups have the little ports on the side, sometimes they're on the bottom. This one is on the side, and we are connected to air. We're always going to give the neb with air unless we have no other choice but to use oxygen. So I'm going to figure out what my medication is. I'm going to do my 3 med checks, and I'm going to pretend to put my unit dose in SimLab. In most situations, all of your nebulizer medication is going to come as a unit dose. So it's going to tell you how much is in the little vial here, and you're going to open it and pour it into the hole that goes into this cup. Okay, you don't have to take the top off. That just makes it easier to drop or spill. So we're going to pretend that I did my 3 med checks and I put my medication inside the cup. So then I'm going to take my mask, and they do come in different sizes. Most of them are universal. This was just a universal kit. They do have smaller ones for pediatric patients. We'll talk about that in the next video. So I'm going to put the mask on the top of the cup, and then before I even turn this on, I'm going to have a conversation with her because I'm getting ready to put something over her face. And depending on the situation, if she is an asthmatic patient, she has anxiety, she's scared, she's short of breath, we never want to put a mask on a patient and then turn on the flow meter. You want them to feel comfortable with what you're doing. So you want to give them a full explanation of what you're going to do to them before you actually do it. So I'm gonna show you how to do that. So Ashley, this is a nebulizer, and the medication that I'm putting in here is albuterol, and it is a bronchodilator, which basically just means it's going to dilate or open up the bronchioles, which is a big word for the tubes that go to your lungs. And so what we're wanting to do is open those up a little bit better, because right now they're constricted, they're closed. And so think of a straw. When you squeeze the straw, you can't get no air through. So that's kind of what's happening to your bronchioles right now. So if we give a bronchodilator and that opens it up and allows you to take a deeper breath, it allows your oxygen to get deeper and oxygenate you better, okay? The medication is albuterol, so typically there is a side effects to all medication, and this medication, it can make you feel jittery, it can increase your heart rate, it can give you a headache, it can make you feel a little dizzy, and it can give you dry mouth. If you start feeling those side effects, please just keep me informed. I'm going to be here with you the whole time, assessing you. I'm going to check your vital signs before and after. I'm going to listen to your lungs before and after to see if it's working. And in any situation, just let me know if you need to stop. This mask is going to go over your face, and this is going to go behind your head. It's going to stay on your face for about 10 to 15 minutes. If you start feeling anxious or anything like that, just let me know, and we can adjust how we're doing this. I may be able to just hold it here by your face for you if it gets to be too much. Okay. Do you have any questions? Nope. Okay. So I'm going to turn it on to 8 is great first, because that's the perfect flow rate. All right. And Ashley, you see that mist coming out. This is going to go into your face. I just want you to take some deep breaths in and out. Okay. And take a breath every once in a while and hold it, and then breathe normal. Okay. All right. So she's wearing the mask and it's on just perfect. It's at a 90-degree angle. If she was to lay back in her bed, the nebulizer may go like this. And we don't want it to do that because then the air can't hit the fluid because the fluid has moved, which means then you won't see any mist coming out. So if your patient lays down or if this moves, you may have to adjust their position so that they can get all of the med. Again, we'll talk about that in the end of the videos so you can see what that looks like. This is gonna go for about, 10 to 15 minutes, and then after it's done, you'll start hearing it make a sound, and then I will tell her, okay, I'm gonna take it off. Okay, so we're done with the neb. I'm gonna take this off of your face, and then I'm gonna turn it off. Don't ever leave the mask on a patient with nothing coming out of it, because that can frighten them, make them more anxious, and you'd be surprised how long it feels. It feels like forever when you've got something on your face with nothing coming out of it. Even though she's getting the oxygen in her nose, can still be frightening and sort of, it can feel like you're claustrophobic with a mask on your face.